Khalsa, Vaheguru Ji Ki Fateh. Ladies and gentlemen, welcome to another episode of Media Watch. It's the home edition. I'm very grateful for all the visitors and guests that we get, albeit remotely. And we have a very special show for you today with some very distinguished people from up and down the country. I'm going to introduce them one by one. We happen to have Mr. I should say, consultants are known as Mr. and doctors are different. So that's the rules. But we have Dr. Rajinderpal Singh. He's a transplant surgeon from Manchester. We have Dr. Talwinder Singh Gill from Middlesbrough, and we also have Dr. Sarabpreet Singh Aluwalia from Manchester. As I said before, they're very distinguished guests. They've taken time out of their very busy schedules to be with us today. We want to talk about three things, and we're not necessarily going through it in the order. There are related themes. The first one is really talking about really we've noticed statistically, and I did find out some figures as well, that, for example, the Daily Telegraph is saying that literally up to 17% of ethnic minorities are sadly going to die if they're in intensive care. This is an issue across the board. I mean, interestingly, in people with a Somalian background have a high infection rate, something 10 times the average in Norway. There's obviously something happening here. And almost 75% of the coronavirus deaths, those NHS patients that were in a BAME background, they were Black, Asian minority groups. So my first question really is to talk about why, in your view, and I'd love to hear your views on this because you're straight there in the front line. Why is it an issue, or is it an issue that people from ethnic minorities have a greater chance of this kind of infection? Rajinderpal, do you want to start us off?
Sure. I don't know, प्यार भरी सत श्री अकाल. Thank you for allowing us to participate in the show. वीर जी, इस तरह है कि this virus, the modality of its approach towards different people, we are seeing that it is indeed different. And whilst we see that in India, and it's a good thing, that the death rate is very low, sadly, the proportionate death rate of the Indian subcontinent people who are living overseas is much, much higher. And that is very, very worrisome. And of the 12 doctors who have sadly died in this country, there is not a single white person, which is a good thing for their community, but certainly not good for us. And one is supposed to think what could be the reason. Now, there are a lot of different aspects that have been considered: social, economic deprivation, and that there is a increased rate of diabetes and high blood pressure in our community. We are probably not as fit as they are, and there are several other causes. However, nobody knows for sure, and if we compare that with India, then the same economic factors, etc., they are applicable to India. So why is the difference? So the first thing that comes to mind is, could there be a genetic aspect really? And the other is whether we have more vitamin D deficiency. Now, I have written a letter to Matt Hancock apprising him of the situation, because almost a month ago this came to my mind that sunshine is a major different factor between the two nations across the fence. And our people here in this part are less exposed to sunlight, and we are having darker skins, and therefore we require a larger absorption of sunlight to create vitamin D. And now, after I sent the letter to Matt, there is much stronger evidence that has actually come up from around the globe, which says that a significant greater chances of death are related to vitamin D deficiency. There are several studies that have shown that we are significantly deficient in vitamin D. Although we are not going to say that this is the only factor, and I'm going to evaluate that as a research with my friend Gurcharan Dhava and my team here in Manchester. But it's important that in a 100-meter race, we are not starting 50 meters behind it. And that's why we need to make sure that we replenish our stores. Then the second aspect is genetic. In Manchester, we are launching one of the largest research trials in the world, which is going to run over 1.5 years. And that is going to actually look into the genetic aspect. We are more blood group B compared to the Caucasians. And there are certain tissue types which are different in us. But again, it is difficult to say why is it that it translates into higher mortality that too only in the Western world and not as much as in India. So I think we have to wait. But there are different aspects, as I mentioned. Socioeconomic deprivation could be there. I'm not too sure about it though. And in terms of exposure to high risk cases, if somebody might say, well, maybe our community is pushed more to the front, I would disagree strongly. Actually, if you go to the intensive care and A&E, it is very obvious that our Caucasian brothers are as strongly represented there as our community. So I certainly do not think that there is inequality there. So I think this is what I would summarize. I would let
No,
my other
it's good. I
colleagues.
mean, yeah, I was going to say the other colleagues around our table today. Would you concur and say that it's a combination? I'll attempt to summarize. It's obviously there was a higher number of medical staff from a black brown background. So obviously statistics will reveal because they have been in the front line. But also, could it be something genetic? Could it be a vitamin D deficiency? I mean, obviously this points to the fact there needs to be more research in this area.
So I agree with everything Dr. Rajinderpal Singh has said. There is an issue with all those factors. But when we're looking for who are affected with the virus, we need to divide those into 4 groups. They are people who are affected with the virus and getting better at home, people who are affected with the virus and coming to hospital and getting discharged after treatment in normal ward, third one who are going into ITU, and fourth group which are dying from this. First 2 groups, it could be those who are living in crowded areas and lower socio-economic status is also possibly is all interlinked. But third and fourth group, patients coming to ITU and patients dying from COVID virus it's more common, or is compared to Caucasians, is BAME background people and ethnic minority people are having more death. So causes would be all those vitamin deficiency. It could be, or it could be, I don't think we will be able to. It may be fitness as well. So there may be multiple factors which are cause for that.
Thank you. That's really useful. Would anyone else like to contribute to that? I mean, I think it's interesting that I like the way that you've divided it. I sadly have to say there may be situations statistically where we don't get the complete picture. There may be many deaths that have taken place at home. There have been many deaths that have taken place in the care homes that came relatively late in terms of the guidance that was given, and therefore infections surged in that area. Tell us.
Yeah, I would certainly agree with my fellow colleagues, whatever they have said. We certainly have many missing links in this information. This virus is certainly new to our community and it has hit us hard. So certainly there is a point of research going on, and there have been calls for a public inquiry into the increased death rate of BAME community, which is Black, Asian, and minority ethnic. And I would certainly support that investigation, which should come up with the conclusive evidence as to why there has been a disproportionate increase in the death rate. Here, I would like to clarify that there hasn't been any studies or data which shows that Black and Asian minority ethnic communities are getting more infections. Rather, it is the death rate which is disproportionate as compared to the white ethnic group. So, as my colleagues have suggested, the only additions I could think of is that we have our culture habits as well, and I know, being born and brought up in an Asian background, that we in our culture habits try to sort out things among ourselves, and sometimes we do take things very far before we seek medical help. And that could be one factor. There are also a disproportionate increase in the number of diabetic and hypertensive patients in our population as compared to the whites, and whether we are taking appropriate care of those diseases. In addition, there have been studies which have shown that obesity and being overweight is certainly a factor which is puts you at increased risk of getting to a situation like going to an ITU or even dying out of this disease. So certainly there are certain factors but we do not really know, are these the only factors, or there are some missing links, and this needs to be investigated.
I think one of the things to think about in the future will be, again, I think I absolutely spot on points about the data. We probably don't have enough information, but I think there's also an issue associated with investment. Research costs money, and it also means that people need to take this issue seriously. I think your point is really valid about the number of deaths versus, why it's necessarily happening in that particular community. I think definitely community habits has got something to do with it. What I wanted to ask you all, because you are all effectively on the front line, whether it be having to look after patients if normal surgeries are not running, right? So therefore somebody has to look after that, or actually being on the front line there and treating patients. What have you found to be the challenges that are? Rajinderpal, I'll ask you first. Have you had specific challenges on the front line? I know there's been an issue. People have been talking about equipment, which is a non-issue in my view, because people have been serving in the wars and they've had no issues at all. I think my question is more around your personal stress level, because, we hear a lot, we've seen a lot of diaries from people that have done video diaries, and they've said it's a mental strain to see colleagues fall, but real people. Because I've said this before, a number is a person. They say like 600 people died. That every single one of them is a life. It's an obvious point, but how do you cope with it? And it's more of an issue for if you're a doctor anyway. You have to cope with these things. But how do you personally cope with the rate of death and obviously seeing your colleagues fall as well?
Well, the thing is that whatever answer I give you now is not going to be applicable because the pandemic is not over as yet, and we do not know what's the worst outcome going to be unless and until we have some kind of a vaccine or a medicine that can cure it, and more understanding of the pathology. This virus is mutating very quickly. So many strains are developing, which could be one factor that why it might be affecting different people differently. Anyway, so in terms of my anxiety level, I would say that my anxiety level was a lot more when the pandemic had started and we knew less about it. But once I started digging into literature, did some parallel research on influenza, the way it spread and all that, then I have realized that the war on mask versus this mask or that mask is more like an academic exercise. You see, medicine is not an exact science, and there is no real evidence about aerosol generating procedures, about how much do actually they generate, and how easily the virus can penetrate through the sides and into you. My personal view is that I have understood from all of this is that hand hygiene, social distancing, not touching your eyes and nose, they are the single most important factors, and wearing a mask, be it a fluid-resistant surgical mask or any other. I would say this is the most important thing, more for the patient and for the public to wear. So my anxiety level has actually gone down with the understanding of the disease process. And I know now that what I need actually is more common sense that is going to save me and my patient. Using the right thing at the right place. And now that we also have got enough of personal protection equipment in terms of respirator hoods and all, that also has taken the added factor away that, okay, we are bearded and, FFP3 mask may not fit on everybody, although I have got a new method which I have used by wearing a Tata and FFP3. I passed the fit test. That's a separate story.
And it works really well. Yeah.
But yeah, and it works. My feeling is that I have enough in my repertoire right now to take this virus properly with respect, give it the respect it requires, and I'm focusing more on treatment and prophylactic methods. And when I go into the battlefront, I have got enough personal protection equipment, support of colleagues and everybody, and we are all in the same boat, Virji. We do not know what's going to happen to you, me, and all of us. We are all in the same boat. My viewpoint is that we have got to use common sense more here. The more deaths that we are seeing in the care homes and all, probably it's not related to PPE. It's just basically the fact that common sense is not being used. The virus is basically spreading more from asymptomatic patients, people whom you think they are all right, those who have no symptoms, a mild runny nose, mild infection, and they think we are fine. And before even they develop symptoms, they are having their infectious rates are much. I would say in the incubation period, they're more likely to spread the infection, and then that's a big issue right now we are facing. So my viewpoint is protection is the most important thing. And protection is best if we do social distancing, we wear masks, we do very good hand hygiene, and our not touching and rubbing eyes and stuff. This is the most important thing. And then once we are put into high COVID atmospheres, then use the proper PPE which we have right now. And I think Talwinder Paji can tell you more about the respirator hoods and
Yeah,
all.
I was going
Yes,
I was going to
as
say,
well.
yeah. So it would be really useful for us to tell us that. And but also, I noticed one thing. There seems to be. I know there's this big number that people keep talking about, 100,000 tests a day, and Bill Gates and other people who have kind of moved into this sector, have all said it's testing, testing, testing. So you can be proactive in terms of being alert, which is the advice that's being given. I guess my final question was more about as the lockdown eases. And exactly, exactly what you said about the fact that you need to be, conscious, and you need to exercise those hygiene aspects. But there must be more, right? That we can do. I mean, testing is an issue, still is an issue, right? We're not getting enough of them, and how do you prioritize who gets what? And then eventually, the other issue is going to be when the virus is eventually eliminated by a vaccine. How are they going to administer that vaccine as well, to what groups, and that still hasn't been discussed either. So, Talwinder, what's your view on that?
From challenges and frontline point of view, I would like to add that we are working in unknown territory. So it's not we are out of our comfort zone. So that gives us a bit of fear, worry about our health, our family, relatives, our patients which are looking after. So because of these uncertainties, there was a more chaos in the beginning, but it's not back to normal. On top of that, there's been lack of resources as well, and that was because the problem is so big. So it's not possible to have that many resources. We are not treating electively or surgical patient. I'm surgeon, so I will talk about my field. We treat bowel cancer. So there was a time we were not even operating on bowel cancer patients. Now we have slowly started that. We are worried about those patients who has got other problems apart from these patients who are suffering from COVID pandemic. And it's not just affecting us physically, it's psychologically also affecting everyone. Is a bit irritable when you are out of comfort zone. So I think what we, as a health worker, we try to do best possible with whatever resources we have. When we feel that we are not able to do, or there is even better can be done, that put a lot of psychological pressure. And once you are in that zone, you become irritable, you are not happy, you fight with your colleagues, not practically fight, but mentally you are not as comfortable as you should be. So I think these are the issues which are affecting more than looking after patients, because they have a standard protocol to follow and we just follow that. But when it comes to psychological, that issue is very important as well.
People definitely need more support in that area. Sarabpreet, Preet, tell me, do you feel the same way? I mean, the question is not only about people looking after themselves, about doctors looking after themselves as well. I mean, we've only got a few minutes left of the show. I mean, I'm very, very grateful for your time, and on behalf of all who am I? On behalf of all the communities, we are extremely grateful for your dedication and effort that you put in, putting your lives on the line. I mean, it's an incredible amount of stress, as Talwinder said, right? I mean, especially if you're not getting equipment and having challenges in that front. But we are given guidance by the government, but it's compounded by people not taking care and actually trusting and being too loose with it. So the guidance needs to be clear, in my view. Do you feel the same way? Do you think the guidance is clear enough, or is it confusing?
I think we are doing less than what we should do, and we've been doing things much later than what we should have done before time. I think we have delayed our response, and it's inadequate as well. It's been a lot of a challenge for us as a healthcare worker, and I would say that not only the patient's health all aspects of hospital care, the teaching of junior doctors, treating elective surgeries, the healthcare workers fear bringing infection home to their family members, which is worrisome as well. So it's all aspects which are being hardly hit by this pandemic, and we don't know enough things about how to tackle it. I think though the government is doing some bit like restrictions and lockdown, which has certainly helped. However, I think the government is under a lot of economic pressure to lift it up as well. And I don't think we are yet ready with all the answers before we can lift those lockdown and the instructions. I fear the infection rate may surge if we take these restrictions out too soon, and we may see a second surge which may be worse than the first one, like it happened during the Spanish flu.
I think everyone is worried about that. Absolutely, everyone is worried about the fact that there's a rush to support the economy. I'm more of a person that thinks you should be thinking about lives. I do think you're absolutely right that if it's done incorrectly and it's done too quickly, there is a potential of a second wave.
You have hit the nail's head here when you said it should be done correctly. I think the best way going forward is that one thing we all know is that the virus is very, very less likely to be lethal to people who are very young, especially if you are less than 35. This is the single most important risk factor. So I guess the people who are going to be in the front line should be youngsters. For example, you can send your son to get and do the shopping for you. So youngsters should run the show, run the country, run the economy, and there should be a strong segregated barrier between them and the elderly. That is the way you will get best of both the worlds. So I guess that's one important way going forward with the available knowledge that we have. That put the youngsters into the forefront. Those people who are already having had the virus, then they should be antibody tested, and if they are immune, they can also be put into the front line, even irrespective of their age. I guess if you are going to have this amount of population to serve, that certainly can help rather than open the lockdown for everybody respectively. So I guess it has to be done intelligently and judicious.
I would like to add the Sikh philosophy here as well, as Guru Gobind Singh Ji and other gurus have brought in a concept of a saint soldier, Sant Sipahi concept. So we are not only acting as soldiers on a front line, working as a community as a whole to tackle this pandemic. We should also work as a saint to guide and to put the knowledge across all fields, our families, our community, and as a society in general, to spread what should be done and what not.
And I would just like to say a very nice summary line. And the summary line is based on one of the Swedish doctor called Johan, who actually summed it beautifully. Basically, the infection, it seems that everybody might be getting it at some point or the other. And how the virus is going to behave in you is going to depend upon genetic factors, socioeconomic factors, how well your body is equipped to. So I guess the best answer is by flattening the curve is we have got to use this time to get a vaccine or a cure. Because there's no point simply flattening the curve, because we are only spreading the deaths into a longer time zone only. So the most important, plus there is a bit of an advantage that the healthcare can be distributed. But please remember, those who go on to have a ventilator, the chances of surviving there is only 50%. So the best important message is, as we have flattened the curve, we have to take the red tapes off the research areas, get some medicines that we know they are working and give it rather than have all the level 3 evidences for that. So those kind of common sense approach is required now.
Absolutely. And I just want to say, we just come to the end of the program. First of all, thank you for your time. Thank you for your advice. Thank you also for all the work that you do in the public, on the front line, the advice that you give, the support that you give everyone, with the challenges that you have, not only in terms of your own mental health, but also the fact that you have to look after patients, and they are in different situations. Maybe some of them are suffering cancer, and you're still having to look after them as well. So it's a very difficult task. We are very, very appreciative, and the advice you've given today is very, very valued. So thank you so much, everyone. Well done, doctors. Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh.
Waheguru Ji Ki Fateh.